Sit down and relax, as stated in choices number 1 and 4. Also, asking the client how the client feels is a good therapeutic technique, as well as an important test-taking strategy. The last portion of this audio tape will review 4 medications that are often prescribed for clients with schizophrenia. Many of these medications have uncomfortable and life-threatening side effects. The nurse will need to be aware of the side effects and appropriate actions to take when they occur. The first medication question comes from Test 8, question number 22, which reads, a 55-year-old client has been taking stelazine for 5 years to control her paranoid thoughts. A client asked her psychiatrist to change her medication to Clozaril because she is worried about developing tardive dyskinesia. What information should she be given about taking this drug safely? Number 1. Monthly blood levels have to be taken to monitor the dose. Number 2. Drug holidays should be taken periodically. Number 3. Weekly white blood counts have to be done. Number 4. Monthly abnormal involuntary movement scale testing is indicated. Number 3 is correct. Weekly white blood counts have to be done. Agranulocytosis, a severe, life-threatening condition, is associated with Clozaril. Weekly monitoring of white blood counts is essential, even though the occurrence is rare. Drug holidays are recommended for other antipsychotic drugs that can cause severe tardive dyskinesia. Clozaril is less likely to cause TD. The second question related to medication comes from Test 10, question number 80, and states, a psychiatric client becomes very agitated. His psychiatrist prescribes Thorazine 50 milligrams by intramuscular injection, PRN. What instructions should the nurse give the client when administering the injection? Number 1. You will need to lie down when I give this injection and should remain in this position for at least 30 minutes. 2. You have to hold your arms still when I give you the injection so the medication goes in properly. 3. This medication can only be given by injection. Or number 4. I have to give you an injection because you need a larger dose than I can give safely by mouth. The correct response is number 1. Good choice. You will need to lie down when I give this injection and should remain in this position for at least 30 minutes. The key strategy in this question is understanding the dangerous side effects of antipsychotic medications. Postural hypotension is a very common and life-threatening side effect. When Thorazine is given IM, the client will need to lie down for 30 minutes to stabilize their blood pressure. Even though you would like your client to hold his arm still when giving the injection, as stated in choice number 2, you would do better to select answers that relate specifically to the drug being discussed and its potential side effects. The third question is on an antipsychotic medication and asked for a therapeutic nursing response. The question comes from Test 7, number 90, and reads, the client psychiatrist orders Prolixin, 10 milligrams BID. Before the first dose, the client asks the nurse what the medication is supposed to do. What response by the nurse would be most therapeutic for a suspicious client? Number 1, it will help you feel less anxious. Number 2, it is to help make you thinking clearer and decrease your fears. Number 3, this medication will help you maintain self-control. Or number 4, this medication will help you get better. The best response is number 2. It is to help make your thinking clearer and decrease your fears. The primary reason for giving an antipsychotic medication is to improve thought processes. The nurse's response should be truthful and specifically answer the client's question. Correct test answers give clear, precise information. It is also important to remember that the nurse's primary role function involves client teaching. This question was pretty difficult, and you did well if you had the correct response. In the last medication question, we will look at what the nurse can do for a client experiencing side effects from an antipsychotic medication. A good example is in Test 10, number 83. The question states, 2 days after a psychiatric inpatient begins taking Prolixin, she comes to the nursing station. The nurse observes she's very frightened, her head is twisted to one side, her back is arched, and her eyes are rolled up. The best action for the nurse to take initially, after reassuring the client that she knows what is wrong and can help, is to do which of the following? Number 1, check her for cogwheeling. Number 2, telephone her physician to report the client's condition. Number 3, give her a PRN dose of Haldol to relax her. Or number 4, give her a PRN dose of Cogentin IM. Number 4 is the correct answer. Excellent choice. Give her a PRN dose of Cogentin IM. Side effects from antipsychotic medications can be an emergency situation and oftentimes very frightening for the client. An anti-Parkinsonial drug such as Cogentin is given IM immediately to prevent dystonic reactions. An important tip to remember is to choose answers that do not involve phoning the physician in a crisis situation. The NCLEX RN exam is looking for the nurse's role in client care issues. This concludes Tape 1 in the psychiatric series. In summary, I reviewed questions that related to the role of the psychiatric nurse, therapeutic communication, defense mechanisms, anxiety disorders, schizophrenia, paranoid behaviors, and medications used to treat psychosis. I hope you have identified areas that you may need further study in, as well as the areas that are your strengths. At this time, I would like to wish you success in your chosen career as a professional nurse.